Okay, so this is an interesting study that came out from the Netherlands recently. This was a rheumatology clinic there. They were looking at their patients who had rheumatoid arthritis, and they wanted to see if there was a significant cost difference in their RA patients who were diagnosed with their condition early or late. And by late, they mean after 3 months. So there are a couple interesting takeaways from the study. The first is that they found that their patients who were diagnosed more than 3 months after their initial symptoms started had a significantly higher cost of care associated with their care and their treatment compared to those patients who were diagnosed earlier. So this really fits well with what rheumatologists understand as this concept of the window of opportunity. In rheumatology, there's this idea of when people have active inflammation of the joints, if you can diagnose them earlier, you can treat them earlier, get them better faster, and prevent more damage long term as well. So, this study really fits well with that, in that it also shows that if you treat them earlier and appropriately at that earlier stage, you'll have less costs associated with that as compared to if you catch them later and treat them later. The second interesting study or aspect of the study is that they took their cohort of patients and they split them up into folks who were antibody positive and folks who were antibody negative. To make a diagnosis of rheumatoid arthritis, you don't need to be antibody positive. You just need to have the classic clinical features. That means painful, swollen joints that's ongoing for over a month with prominent hand involvement. So, what they found was that in folks who are antibody positive, that's the classic kind of RA presentation, that if they were diagnosed later than 3 months, their cost of care was 46% higher than if they were diagnosed early. Really high, right? Much higher. They then looked at the folks who were antibody negative, and they found that their cost of care, if they were diagnosed later than 3 months, was over 300% more expensive. That is wild. And they don't really discuss why that is, but I can give you a good reason, which is that a lot of times folks who come in with painful, swollen joints, they may have seen another physician or provider at some point, and they had some labs done. Their antibodies came back negative, and they're told, well, you probably don't have rheumatoid arthritis, and they just let it go. They don't really get an answer. And that's a mistake. Because again, a diagnosis is not just made based on your labs. If you've got findings of inflammation in your joints on exam or on imaging, and for me, the preferential imaging is ultrasound because you can look for inflammation. Then, if you have that, then you can still have a diagnosis of rheumatoid arthritis. And so, it's likely in this case, the folks who are antibody negative probably fell through the gaps or fell through the system and just weren't diagnosed and weren't treated appropriately because they were antibody negative. So, really, biggest takeaways here are if you've got painful swollen joints, don't just let that slide. Get checked out, get treated, get back to your normal life. You don't need to suffer. And still makes a difference not only in terms of pain, inflammation, and long term medical outcome, but makes a big difference also in terms of cost outcome because maybe you don't need as aggressive treatment if you're caught earlier. Not to mention, you can probably avoid a lot of the surgeries that occur if you've had chronic damage in the joints. So get checked out, get treated, get back to your normal life.